Good afternoon, everybody, and welcome to this short session entitled Politics, Advocacy and Influencing, the latest updates for speech and language therapists. My name's Derek Munn, and I'm the Director of Policy and Public Affairs at the Royal College. So having chaired a number of sessions in the last 36 hours on SEND reform, public health, artificial intelligence, I now get to do a session on the day job, which is the work of the Royal College in political advocacy and influencing. And of course, all of our work in this area happens ×4 with the 4 governments of the United Kingdom in the UK, Scotland, Wales and Northern Ireland. And we'll be running through the latest in each of the nations. Feel free to ask us about the specific policies that we mention, but also anything that you would like to know about how the Royal College does its political and influencing work. First of all, I'm pleased to hand over, though, to my colleague, Head of the Northern Ireland office, Ruth Sedgwick, to lead us through, housekeeping, how could I forget? For the last time for me, I get to tell you about the housekeeping. Questions in the questions tab, please. Please keep it respectful in the chat. Recording available for 6 months, but I guarantee you that what we're about to say will be out of date in 6 months. And please use the feedback tab and the secret code to get points at the end of the session. And now, at the second time of asking, Ruth, over to you.
Thank you so much, Derek. So as Derek said, I'm Ruth Sedgwick. I am a speech and language therapist and I'm head of the Northern Ireland office. So I'm going to take you through a little bit of what we have been up to and some of our plans for 2026. And what you're going to see as we run through the next few slides is that the themes are similar throughout all of the different nations in the UK. The work we do is in line with the RCSLT's strategic priorities. And then we are part of the PPA team, so that's the Politics and the Public Affairs team as a whole, have our own objectives as well. So we will also set individual priorities as a nation relevant to the different structures and systems and what our members need in the individual areas. We're all a little bit different. We have 4 very different governments that function in different ways. In Northern Ireland, we are unique. That's one way to describe us. And we are delighted that our executive and assembly is still currently sitting at the moment. I'm going to touch this wooden table as I say that to you because it is precarious at times, but the executive has been sitting since February 2024. And we became very busy then. So fingers and toes crossed that we remain with our own government. And you'll have to excuse my croaky voice today as well. I'll assure you that I have my water and I'm steaming and doing all the things that I should be doing. And I will go back to resting them when I've done with this short talk today. So next slide, please. What you are going to see then are the priorities. So I'm going to take you through the 5 priorities that we have here in Northern Ireland that we've been working on throughout this year and as we move to 2026. So firstly, workforce. It's no surprise. We were absolutely delighted with this year's announcement from the Minister for Health. There was a record increase in the number of commission places for our one course. We have one small course in Ulster University. The commission places sit at 28, and this year there was a 100% increase, taking that to 56. I think that's my maths is right. So this was from a lot of long, hard years of lobbying and asking and showing the need for more speech and language therapists. But our job doesn't end there. This is just for this year, so we need to continue to build on that, of course. A few strands of work for us then under the fair access to all. We are all about driving equalities and driving equity. And one of the pieces of work that I'm really passionate about at the minute is about instrumental assessment. So a survey was carried out in all of the UK actually across members looking at access to instrumental assessment. We were focusing on fees and VFS in Northern Ireland. And what we saw was that there really still is a postcode lottery. And this is especially poignant in Northern Ireland, where we have a couple of trusts that have little to no real access at all. So it's something that I would like to look at producing a report with the support of our members, with recommendations that are really going to support members in developing and asking for commissioning for services. Another key area for us this year has been the Department of Education's publishing of the SEN Reform Agenda. As part of this 5-year plan, they included a specific speech, language and communication section. So we were delighted with that. But what's really important going forward for these 5 years is that we ensure that speech and language therapists are involved and embedded in the plans that they are currently creating and in the implementation of the services to ensure that whatever is put into place, whatever services are put into place, are effective and quality assured as well. Another piece of work that Sue from my team has been leading on is with the examination bodies. And this is really about improving accessibility of exam papers to ensure that our children and young people with speech, language and communication needs, for example, DLD, have fair and equitable access to really show off what they know within an exam paper. Because we all know sometimes in an exam paper, if you remember back to your dreaded GCSEs, that half of the battle is understanding what the question is asking you to do. So it's really trying to strip that back and getting down to how do we show our knowledge and making sure the language is as accessible as possible. So the last point then here, and the picture that you'll see at the bottom right, is around CAUK or communication access. Hoping you will have all heard about this, hoping that you will have maybe even done the training or have heard people in your department talking about it. And if not, please go and look it up after this. We are lucky to have a really passionate advocate for Communication Access UK that works with us in Northern Ireland. So this is Peter Bradley in the middle of myself and Sue. He is a watch commander in the Northern Ireland Fire and Rescue Service, and he has a stammer. So he's really, really passionate about bringing accessibility into all public facing services. And he has worked with us to embed communication access values and priorities within the Fire and Rescue Service, and even now we've got it adopted within the PSNI as well. So we've been working with him, we've been training our local politicians. We have plans in the new year to train our Commissioner for Older People's Office and actually some other community and voluntary sector organisations we've got signed up as well. So more to come in 2026. Next slide, please. So this theme is not a surprise. This runs throughout everything that the RCSLT does as a whole. We love our members. We want you to feel supported and empowered. We want you to be fulfilled in the work that you're doing. And that is really, you are the backbone of everything that we do. So in Northern Ireland, we send out a Northern Ireland specific monthly newsletter to keep our members up to date with all the things that we're doing. We run different events as the other nations do as well. We will have conferences and we'll also, this year, we did our very first, that's what the picture is, we did our very first awards celebration. So this was to celebrate 80 years of the RCSLT and 20 years in Northern Ireland. And this was, the feedback was absolutely fabulous. Members just felt there was definitely a party vibe. There was no CPD in sight. This was about supporting members to really have fun, let down their hair and enjoy the innovation and the hard work of each other. So really a great way to strengthen our peer networks and celebrate their achievements. And we'll have another conference coming up in 2026. Next slide, please. So number 4 is really central to all that we do as the policy and public affairs team, and that's influencing and collaborating. Our aim is to educate, to influence the decision makers so that they understand the need for and the importance of speech and language therapy. Building relationships is absolutely key. And with the politicians, we've worked hard on this so that we have such good links that they will contact us if something arises and they feel that they need some insights into that to do with speech and language therapy. We're also seeing these links in the number of assembly questions that are asked. We sometimes will prompt a question, but this morning I was reading through the monitoring bulletin for November, and I still haven't read through all of the questions that have been asked that are related to speech and language therapy. It is now in the minds of these politicians, which is absolutely fantastic, and they're asking the necessary questions. Building relationships with department civil servants is also extremely key, And this led us then to our project Language Launchpad, and you can see the logo for that, and I'll talk about that in a moment. We respond to policy consultations, we work really hard to shape policy, and we want to champion inclusion and accessibility. And we even have plans for our own Voice Box Awards next year, and Derek will tell you about the Scotland Voice Box Awards this year. Lastly, number 5 is around impact and innovation. And we want to highlight the impacts, the inspiring creative solutions across our health and education services. But it's really, really important for us to show the real world value of speech and language therapists. And data is key to this. So we're really, really driven on having accurate data to show and to share our stories. And in 2024, we published a report called We Are the Village, and that highlighted the increasing numbers of children in Northern Ireland with speech, language and communication needs. And from that, if we look at the next slide, please, we can see that Language Launchpad was born from that. So following our report, the Department of Education funded us to do a 6-month partnership project with them and with community partners Help Kids Talk. We produced a survey. We surveyed our early years partners, Sure Start, nursery schools, teachers, everybody in the sector. We looked at what they need and what they want and what their worries are around speech, language and communication. And we then took that and Help Kids Talk worked really hard to produce fabulous free resources on their website, and you can find more with that QR code there. And this was all launched in Stormont. So that just shows you the power of our influencing and our partnership and our collaboration as well. So I have one last slide that really just shows you a bit of an overview. If you want to go to the next slide, please. Thanks, Hannah. You can just see some of the different events that we do. And again, you'll see this throughout all of the nations, but we'll have different ways perhaps of doing things. We will go to the party conferences. So there's just 2 pictures from this year, the Ulster Unionist Party Conference, then the Social Democratic and Labour Party Conference as well. And we will talk to the politicians about speech and language therapy and the key issues there that we have in that moment. We have this year, so as part of the Allied Health Professions Federation, which is a UK-wide group of all of the AHPs, we have a Northern Ireland contingent. And we were delighted to meet the new Permanent Secretary for Health and to set up quarterly meetings with him. So we've now met him twice, which is excellent. Advancing Healthcare Awards. So what looks like, I think some people say, oh, Ruth, you have a lovely time of it. You're always dressed up. You're going to these parties. And while that may be true, it's hard work. So when we are sitting, just as an example, this was some of those that were at our table at the Healthcare Awards just this October, but I was sitting beside a BBC health reporter and the chair of the health committee. So it was definitely work, but it's all part of our relationship building and our influencing. And then last but not least, the media and the work that we do to increase the knowledge of speech and language therapy in the general public. And that is just a snippet of our DLD road trip just this year. So that's really all I'm going to say to you now about Northern Ireland, and I'm going to hand over to Derek.
Thank you. And thank you. I think what you've done there, Ruth, is give a really good picture of the scope and nature of the influencing activity that we undertake. So let me run you through the other parts of the United Kingdom. So Cymru, Wales, moving on, was the very first week of January, the beginning of the 80th anniversary year, and we took the opportunity to hold an event in Senedd Cymraeg, the Welsh Assembly in Cardiff. On the left, you see Emma Donaldson, the chair of the Board of Trustees. On the right, you see Jeremy Miles, the Health Minister in the Welsh Cabinet. And in the middle, you see Pippa Cottrell, who's Ruth's opposite number, head of our Wales office, with the report that we launched that day. So we kicked off the 80th year, making use of it as an influencing opportunity. Moving on. For those of you in England, you'll be aware that we had a UK-wide general election in July of last year. And since then, the UK government has had mixed fortunes, let us say. But the political cycle works slightly differently in Wales and Scotland, where the critical elections for the Scottish Parliament and the Welsh Assembly take place next May. And because health and education and in large part justice are all devolved to those institutions, our focus is right now pre-election building up to an election campaign, and in particular, influencing the manifestos of political parties, both the speech and language therapy, but also as part of the wider allied health family. So what we're looking for in Wales, we can see that we want the next Welsh government invest in the speech and language therapy workforce. Apprenticeships, again, apprenticeships at the moment to become an SLT only exist in England, and we've got a key ask to get the apprenticeship route into the profession extended into the devolved nations. We want a comprehensive workforce strategy for speech and language therapists and other HPs in Wales. And we've got a particular ask around justice, making sure that speech and language therapists are embedded in every youth offending team in Wales. So we work with all the different political parties in Wales to try and get these things to happen. Moving on. We need to engage because it's already a proportional system, and there's a new election system in Wales next year, and it's going to be strictly proportional. So percentage of votes you get will be the percentage of seats you get. Very unlikely that anyone will get 50%. Parties will need to work together. Opinion polls at the moment suggest that the single largest party in Wales next May will be the Reform Party. And that's an issue for everybody working in the field. Okay. Moving on. So here are the Wales team in action, engaged both as AHPF is the Allied Health Professions Federation, and also as RCSLT. Here we are engaged with meeting politicians, attending political party events to push forward those asks that I've already outlined. Moving on. Scotland, similar in the timing in the political cycle, but clearly the asks are slightly different because the Scottish Parliament has different powers and the state of play is slightly different. So moving on. Here are RCSLT Scotland's priorities, and Scotland has 6, as you can see. Supply of speech and language therapists, the funding for speech and language therapy. There's one which is about developing leadership capacity in the profession in Scotland. There's another about the well-being and engagement of members in Scotland for the Royal College. Raising profile related to what Ruth said around media and political profile raising. And getting better policy. There's the how, but there's also the what. There's ensuring that we improve and influence policy both nationally and locally. So, moving on. Building the case for SLT. So here's the third national head. This is Glenn Carter, who is the head of the Scotland Office of the Royal College. And you can see him there in 2 different occasions, actually, on the BBC in Scotland, relating to the reports you can see on the left and the right, one of which was around rights, because the Scottish government is very keen on its human rights-based approach, and the United Nations Convention on the Rights of the Child is embedded into Scots law. And the report we had on the left was about how you make those human rights of children, those convention rights internationally, a reality for children with speech, language, communication and swallowing barriers. The report on the right around transforming support for children and young people with communication needs, you can see from the logos at the bottom that this was a partnership report produced with the Association of Directors of Education in Scotland, the directors of AHP in Scotland. So it's back to going, when we talk about the importance of speech and language therapy, it's not just the Royal College saying it, because we wouldn't we? Actually, here's a range of others who also say that speech and language therapy is critical. Moving on. So here we see the engagement, and in particular, you can see the voice box competition. We've done this. This began in Northern Ireland. Over the years, we've done it in all 4 nations. This year, we did it in Scotland. It may or may not be on the next slide too, so let's take a punt and go to the next one just in case. No, it isn't, but never mind. What it is a joke-telling competition for children, and some of you listening today will have been engaged in it. And absolutely brilliant. We are able to involve local schools in joke-telling competitions. We're able to get local media and political coverage. Then we go to the National Parliament, in this case, the Scottish Parliament. What I particularly love about it, though, is that it role models communication accessibility, because amongst the children telling jokes, you've got children telling with videos because of neurodiversity or selective mutism. You've got children telling their jokes with AAC devices. You've got children telling their jokes with British Sign Language. But it just all becomes part of role modelling how communication access can look in reality. Here's our asks in Scotland for the elections next year. And we begin with the bold one, embedding speech and language therapists in every school and nursery in Scotland. And we've done a lot of work to back that up. We also talk about expanding access to the SLT profession. That's about apprenticeships again, but it's also about the need for a third course in Scotland, probably in Aberdeen is what we're looking for. Specific focus on adults and the priority needing to be given to adult SLT. And then Ruth's already talked about Communication Access UK. We're doing that in the Welsh language now. And this is about strengthening the right to communication for everyone in Scotland as a legal matter. So those are our manifesto asks. Moving on. I'm not going to go through these in depth. The slides will, I'm sure, be available afterwards. But this is where we then exemplify what we mean by each of the manifesto asks. So here's embed school speech and language therapists in every school and nursery. And importantly, we don't say, give us more speech and language therapists because we're lovely. We say, here are the social benefits, in this case, breaking the intergenerational cycle of poverty, addressing the link between communication and attainment, reducing stress on teachers. Here are the benefits that are going to come from an increase in speech and language therapy provision. Moving on. This is about workforce and particularly rural workforce. And obviously there are particular challenges there in the Highlands and Islands of Scotland around that. Moving on. Addressing adult needs is about inequality for people who are in work or want to stay in work alongside their communication challenge, but also preventing admissions and readmissions, dysphagia in the community and what that can do to support reduce admission and readmission at end of life. The current government in Scotland, which is SNP, had pledged to put the right to rehab into law. That hasn't happened actually. So we and colleagues in other professions and charities will be going back asking for it again next year. Moving on. Communication rights. So using Communication Access UK and others schemes to say, look, communication is a fundamental human right, and with Scotland's rights-based approach to government and legislation, this should be put in the law. Okay. UK stroke England. And it's an interesting one. Do we have an England team? Not really, but most of what the London team do, I say the London team, one of them's based in Scunthorpe and one of them's based in Hastings. That's the world post-pandemic. But we mirror the devolution settlement. There isn't an English government, there isn't an English parliament, but most of what Westminster does is policy which is England specific, except things leak over the side. So when we talk about prescribing rights, for example, that's something that's actually UK-wide. When we look at the implications of lots of mental health legislation, well, actually that crosses over into Wales. So the UK constitution is not neat, and we need to be equally nimble. We also, of course, have members in the Channel Islands and the Isle of Man, and we need to take, for example, on assisted dying, it's actually going to be Guernsey and the Isle of Man that have the first legislation on assisted dying. So we need to be cognizant of that too. Okay, so moving on, these slides are just a snapshot of hot issues that we're working at UK level, mostly but not entirely England focused. And I think top of the list right now would be SEND reform. As I say, there have been other sessions at this conference. We are waiting for the white paper, which is delayed to the new year, but there is little that's bigger for children's services and independent therapists working with children in England right now than what might happen to the future of education, health and care plans, which, as we know, can dominate time and resource. Parents are very concerned about the loss of an individual specialist plan and about the loss of a legally enforceable right for their child. We understand that. We also know that an effective, and the term that's being used is local inclusion support offer, an effective targeted offer in every school will dramatically reduce the need for that specialist provision. And some of it's about which order it comes in, and some of it's about what the government is seeing in terms of evidence and what it feels able to do, given the pressure that there is on Labour backbenchers. So the white paper has been delayed again into the new year for what Bridget Phillipson, the Education Secretary, called a further period of co-creation. And we are intensely involved in that work right now, often behind the scenes on areas that we can't comment on publicly, although I could tell you in the pub if I could meet you there. The NHS England 10-year plan, plenty to welcome in it, but it's a statement of good things, isn't it? Who wouldn't want to move from hospital to community? Who wouldn't want to move from sickness to prevention? Who wouldn't want to engage what we can do on digital? We need, though, to articulate, particularly with the workforce plan, where we've just responded to the call of evidence, that too has been delayed to the new year, and show with evidence how speech and language therapy makes a difference to shifting from sickness to prevention, to shifting from hospital to community. And in particular on digital, where the NHS 10-year plan is all about self-care through the NHS app, making sure that that digital offer is fully communication accessible. Part of this is what's called the Neighbourhood Health Service. There was a lot of that in the budget this week. And again, we need to make sure that that isn't just GP services plus, it takes account of everything we've got to offer in the community space. This is where people in Scotland, Wales and Northern Ireland can look with pity on the complexity of the health structures in England and the way they constantly change. But integrated care boards are currently merging, they're reducing. There's a blueprint around that we've got analysis of, and we need to keep on top of that and support members working on it locally. Okay, what's next? I think it's children or adults. No, co-production. So wherever we can, our influencing and lobbying work is co-produced with people with lived experience. And Mikey Akers, a tireless advocate, a young man with childhood practice of speech, although he's now an adult, led this petition, which went to Parliament. It led to a debate in Parliament. It led to a meeting with the minister. Moving on. There is nothing more powerful in our influencing and advocacy work than the voice of people with lived experience of speech language communication and swallowing barriers and channels. We've also been working around the Inclusive Parliament campaign. This is about Parliament itself being more communication inclusive for visitors to the parliamentary estate, but also for members of the House of Commons and members of the House of Lords who themselves have communication challenges, sometimes hidden. Moving on. Adult policy in England right now. We've done a lot of work this year on primary progressive aphasia. We managed to get that, win the case for that to be nationally commissioned, but we now need to make it a real thing. We've got representation on the National Dementia Steering Group, which is good. We'll be meeting with the Minister at the implementation stage of the new mental health legislation. A lot of it's about the circumstances in which somebody can be compulsorily detained, and we need to make sure that both the communication and indeed swallowing aspects of that are got right. We've been working a lot with Chris Whitty, for those of you who are Chris Whitty fans from the pandemic, around prison health, where his review of prison health, just out, says all the right things from our point of view about speech and language therapy in prisons, and we're refreshing our criminal justice training and also adding a face-to-face offer. Moving on to children. I've mentioned SEND reform, and a lot of this is about evidence to parliamentary select committees, sending members of staff, but more often members of the profession, to give evidence to parliamentary committees. We've also had a lot of work on waiting times, because that's a huge focus for adults as well, but a huge focus on children's waiting times in England. And we are actively asked to sit on the national groups which help address and come up with solutions to these things. And early language, where the UK government has a commitment on school readiness, has a commitment on early language, and again, we are part of trying to make that real in practice by sitting on the right groups that are developing it. I think that might be it, or maybe there's one more. That's it. Brilliant. So there is our whistle-stop tour in half an hour of current hot issues and what we've been doing across the 4 nations of the UK. I can see out of the corner of my eye that questions have been coming in, and I'd like to hand back to Ruth, who will lead us through the Q&A.
Okay, thank you, Derek. So we have a few questions here, and I see that you had actually answered one, but there's another one around the modified exam papers. So just in case anybody hasn't seen, the first question was, is the work on exam paper sounds great? Is this happening or has this happened elsewhere? And Derek had said, although Northern Ireland have taken the lead, this is across the whole of the UK, and there is a 4-nation working group that have been supporting us with that. And that is literally happening at the moment in terms of the report has been compiled and has just been signed off this week and is then going to be sent to the Joint Council for Qualifications. So the next question then says, can you roughly predict when the exam paper changes could be made by? Will the change affect the cohort sitting the exams in this academic year? We don't have the answer to that. Derek, I don't know if you want to come in. I would say no. I don't think anything would happen as quickly as this year. But I hope that you would see it in the years down the line, but we just wouldn't know the answer to that. What we need to see is get this letter sent off within the next day or two, and then hopefully we will see, and we will tell our members about this whenever we get responses in terms of what the future plans are. So thank you so much for your interest in that. Okay, the next one then is, there are speech and language therapist run organisations which are set up as businesses, and they would like to be involved in influencing but seem to be prevented from doing that. Are there any ways to be better involved?
Yes, absolutely. Certainly no prevention from the Royal College point of view. Wherever possible, particularly on workforce matters, but also on things like SEND, we will be working very closely with SLTIP. I met with the chair of SLTIP, Nicola Holmes, this week to talk about access to schools for independent therapists, to talk about respect being given to colleagues in independent practice, to also talk about the challenging issues around the use of interpreters in speech and language therapy. So we actively work, co-produce with our independent sector colleagues wherever we can. That's largely through SLTIP, and I know that not all members in independent practice are SLTIP members, but the member asking the question, if you want to be engaged in influencing work, come right along, because we need, and to take an example, if there is a dramatic change to the SEND system in England, we need to be working right now on how the independent sector can be part of the solution to what's needed going forward, and how the model of provision can adapt in that way. So no barrier to independent sector, private sector therapists being involved, and get in touch if you want to be part of that.
Absolutely, please get in touch. And just as an example, in Northern Ireland, we have used our independent practitioners for our media, who are great and have been great at getting us families and stories and being interviewed. So we really, really welcome any independent practitioners getting involved. And then we have another one. So this is our last one at the moment. So in terms of RCSLT strategy and policy, Steve, our CEO, has a very credible and strong resume of experience and was CEO at the Royal College of Podiatry, so has a wealth of experience to take RCSLT forward. And he is a nurse. Should we therefore be seeking future CEOs from within our profession?
Thank you. I think there's also a question on Wales, Ruth, which I see, which we can deal with.
I'll do that.
Thank you. Look, Ruth and I are employees of the Royal College, and it's not a matter for us to determine what the job criteria should be for the chief executive. What I would say is that, obviously we'll know that Kamini, the CEO before, was a speech and language therapist. Steve, having been CEO of the podiatrists, brings expertise, having been director of nursing at the RCN, brings that expertise and all that wealth and context. I should say also that Steve is a nurse, but when I've seen him in adult acute contexts with his own specialism in end of life, his specialism in dementia, palliative, his specialism in work related to HIV, a lot of credibility and support with our members in the adult field. So I think there are advantages and disadvantages, but employment matters are not for Ruth and I to comment upon.
Thank you, Derek. I'm glad you took that one. Okay, so then lastly, there is one that I almost forgot about, which is about Wales. So it says, in Wales, we need serious help in rural areas, not only with finances, but with recruitment, retention, and career development.
Yeah, and we're on this right now to the member who put the question in. If you're not in touch with the Wales team already, please do get in touch with them. So graduate recruitment is an interesting one across the UK. Nurse graduate recruitment is what's driving a lot of the concerns. In some parts of the UK, we're not hearing issues with graduate recruitment. And the recruitment challenges are at band 6 and 7 and have been for some years now. However, in Wales, we are hearing significant challenges with new graduates getting their first role in Wales. And I think we can comment on anything in Northern Ireland. So we're alive to the issue in Wales, and the Wales team are working on it right now. It's interesting for me, sitting across all 4 nations. England, in many ways, has a free market in how many courses are provided and how many speech therapists you can train and where they then work. Wales has the tightest system in terms of, we employ this many, they're meant to spend this long in the NHS afterwards. You'll get one job, but you may not be able to choose where you go. And again, there are pros and cons to those matters, but we're alive to those graduate recruitment challenges, in retention challenges in Wales right now. Get in touch with the Wales team if you want to be part of that. Ruth, anything on Northern Ireland?
I mean, I guess that there are issues with recruitment and retention across, all of the 4 areas of the UK. And for us, we have had a few queries and concerns from some NQPs that haven't been able to get work, which obviously we don't want, and we can understand how frustrating that is. We have a regional recruitment process over here, which has its flaws, but is one interview instead of lots and lots. And has a long waiting list, but it's really then that one chance for you to get on that waiting list and to get a job. So there are, certainly in Northern Ireland, there's work being done at the Department of Health level. It's sort of reviewing the whole system, but we understand it can be frustrating. There's one final question has come in about where can we read about the exam paperwork. So I was just going to say, if you did want anything particular or you wanted to see the report, if you just get in touch with us, we can give you a bit more information.
Yeah, we have an evidence dossier now, which backs up what we're asking the exam providers. So cool.
Yeah.
Brilliant. Thank you very much. This is a 40-minute session, so that's time. Thank you so much for being with us on the afternoon of day 2. Please do excitedly take your secret code and put yourself up the points table. I'm not sure whether I want to ask for feedback on this one, but I guess I should. So please do leave us your feedback. But I hope that that's given you more of an insight, both into what we are working on right now in terms of political influencing and advocacy across the 4 nations of the UK, but also some of the how of the techniques and tools that we do it. So thank you very much for being with us, and good afternoon.